Welcome to Dr. Ali Explains. Today, we'll discuss an important procedure that helps save millions of lives: stenting and balloon angioplasty. If you or someone you know has heart disease, this video will explain how a stent can open blocked arteries and restore blood flow. Coronary arteries supply oxygen-rich blood to the heart. However, due to high cholesterol, smoking, diabetes, and high blood pressure, fatty deposits called plaques build up inside the arteries, causing atherosclerosis. Over time, this narrows the arteries, reducing blood flow and increasing the risk of heart attack. To open the blocked artery, doctors use a procedure called angioplasty with stent placement. A thin, flexible tube called a catheter is inserted through a blood vessel, usually in the groin or wrist, and guided toward the blocked artery. Once the catheter reaches a blockage, a small balloon at its tip inflates. This balloon pushes the plaque against the artery walls, widening the passage so blood can flow freely. However, this is only a temporary solution because arteries may narrow again. A stent is a small, mesh-like metal tube designed to hold the artery open permanently. It acts as a scaffold to keep the blood vessel from collapsing after the balloon deflates. Some stents are coated with medication to prevent re-narrowing of the artery. After the artery is widened, the stent is placed in position. The balloon is inflated again, expanding the stent and locking it into the artery walls. Once the stent is securely in place, the balloon and catheter are removed, leaving the stent to keep the artery open permanently. The stent keeps the artery open, allowing blood to flow freely. Over time, the artery heals, and new tissue grows around the stent. However, lifestyle changes, including a healthy diet, exercise, and medications, are necessary to prevent further blockages.